the adult and pediatric cardiac surgeons. And I think the complexity of those cases really lends itself to the idea of, let's stop for a minute, let's talk about what we're going to do, how we're going to cannulate, do we need anything special in the room.
It's been successful is because it's a top-down phenomenon in that the surgeons have bought into it, and I'm not trying to be flip about it, but they've wholeheartedly accepted it, and with that in mind, they've imparted that to the staff. And so when they walk in the room, it's understood that there is silence in the room. We all gather around the patient, and we go ahead with a very formal briefing as to our course during the day. We continue with the case, and as we even go through a case, we'll even say, hey, let's bring that up later in the debrief because this is a potential problem. At the end of the case, once again, after the patient might be extubated or before we're physically leaving the room, we'll all once again gather around the patient and say, okay, what are items for debrief here, and in fact, how we can change them. And this is an ongoing daily process which we have wholeheartedly accepted certainly in the pediatric cardiac surgery realm in an effort to get better. The reason why I'll say I'm more attuned to it because I'm also
we've
a pilot.
been real good at, and I've definitely been guilty of it. We implement something new, but we don't go back and follow up to make sure those things are continuing.
Protocol and checklists, and when you do, that's when you get into trouble. One of the take-home messages that I think really needs to be reiterated here is that we're harping on this. How successful we are with regard to the cardiac program. But remember, taking off in the 747 is just as important as me taking off in the single-engine, much, much, much less complex aircraft. The point being, like Joe was alluding to before, when you do a simple hernia case, it should have the same importance and relevance to this program as does the cardiac case.